the new COVID vaccine is available to the public, and it's been available now for about a week, and I think it's getting out into the retail market. It's also, of course, time for people to get their flu shots. So, again, based upon the questions I've been getting, I thought it was a good idea really to get Dr. Vanderhoff here and just to kind of go through some of the questions that I have been receiving. So, Doctor, thank you very much for joining us. And maybe if you could just go through and talk a little bit about the new COVID vaccine and who it's appropriate for. And I'll have some questions. What I'll try to do is ask some of the questions that I've been getting from people. But why don't you start off and tell us about the new vaccine and tell us what we should know.
Well, thank you, Governor. COVID-19 really remains a very real health threat. Indeed, we've been experiencing recently a rise in COVID-19 cases, along with some increases in COVID hospitalizations. Now, we're, of course, grateful that these increases haven't approached the levels of past years, but that's likely due in no small part to the hybrid immunity that many of us have developed as a result of vaccination in combination with past COVID infections. That said, a recent increase in cases and hospitalizations really just reaffirms the importance of staying up to date with vaccination. Now, earlier this month, the U.S. Food and Drug Administration approved the use of a new COVID-19 vaccine designed to target some of the more recent Omicron variants that have driven cases right here in Ohio. The CDC has recommended this new vaccine for anyone 6 months of age or older who has not received a dose within the past 2 months. But this new COVID shot is particularly important for those who are 65 and older, as well as those who are immunocompromised or have serious underlying chronic health conditions, because these Ohioans are the ones who continue to suffer the largest burden of severe illness and death from COVID-19. But the new vaccine is now available, although following the end of the federal public health emergency in May, providers are ordering that vaccine directly from the manufacturer, just as they do other vaccines, rather than through federal and state authorities. Now, if you have medical insurance, and that includes Medicare or Medicaid, these vaccines should be covered as a preventative health service, which means you'll likely have no out-of-pocket costs. Those without insurance can take advantage of several programs to ensure they also have access to the vaccine at no cost. For example, the Federal Vaccines for Children program that allows ODH to offer vaccines free of charge to eligible children, including those who are uninsured, will be available through our network of VFC providers. And for adults who are uninsured, the CDC has created a bridge access program, which will be in effect through the end of 2024. As part of that program, the CDC has contracted with CVS, Walgreens, and eTrue North pharmacies to offer free COVID-19 vaccinations to the uninsured. And lastly, on the new COVID vaccine topic, if you are seeking to find providers who are offering the new COVID vaccine, you can visit the CDC's website, vaccines.gov. There you can filter your search by where you live, your age group, and even if you want access to the vaccine through the new Bridge program, you can also call their number, which is 1-800-232-0233.
Doctor, let me thank you for that succinct answer. People have asked me, okay, I've had a booster some time ago. Or some people have said, I got one shot. Others have said, I haven't got any shots. So what's appropriate now? I think one of the things you told me this morning when we talked about this was you kind of look at this as, in a sense, starting over as far as the vaccines are concerned. Is that a good way of looking at it?
Yeah, I think that is. And really what the CDC and the FDA have done here is say, we have a new formulation. And this new formulation has real benefits. Anyone 6 months of age or up is recommended to get this. But, you know, when we look at the data, it is very clear that that population 65 and older, and those who have those underlying serious health conditions and immune system issues, it is especially important for them. The data is really compelling that they need to get out and avail themselves of this protection.
If we look at the last time people had boosters, we had less than 50% of the most vulnerable actually get those boosters. Now we're starting, in a sense, all over again. And so I'm going to ask Eric to put up on the chart something that we will continue to display every week, every Thursday, the number of people who have, with the new vaccine, number of people who have been vaccinated. And you can see the numbers here. And again, the numbers are low, as we would expect, because this has just gotten started. But we break it down not just in the total, which is a little over 87,000, but if you also look below that, age 60. And again, the reason we break it down age 60 and over is that is the most vulnerable population. And that really, I think, in our message today is the main target, those people who are the most vulnerable. And I believe what you're saying is, whether you've had vaccine before, if you've never had it before, if you've had a booster, if you didn't have a booster, this new vaccine is now appropriate for you, no matter what situation you were in. And it's particularly appropriate for you if you have underlying health problems or if you're 60 years of age and older. Is that a fair summary?
Governor, I think that is an excellent summary. I honestly, I can't add a word to it.
Where does flu come in? People now going in, I assume that they can get in most places, they can get a flu shot at the same time they can get the COVID shot.
Yeah, that's absolutely right. You know, COVID, of course, is not the only serious respiratory virus that we need to be thinking about protecting ourselves from this fall. Last year, as you may recall, here in Ohio, we saw very high numbers of influenza as well as RSV. I think the good news is that right now, the flu and RSV seasons do not look like they've started in earnest yet here in Ohio, but we know that they're both just around the corner. So now is the ideal time to go out and get your flu shot. We have a long track record with these flu shots. We know they make an important difference in helping to prevent serious illness. And you can absolutely get your flu shot and a COVID shot at the same visit. The only caveat is you might want to get one shot in each arm just to try to reduce some of the soreness.
Doctor, to talk a little bit about RSV and who a shot is appropriate for in regard to that. You told me this morning we basically have two categories, one at the beginning of life and one older. You want to explain that to us?
That's absolutely correct. So the third virus that really hits us hard during that fall-winter respiratory season is RSV. And as I've shared before, nationally, This is actually the leading cause of hospitalization for our youngest, our infants who are under a year of age. Now, in terms of that population, the FDA has approved and the CDC has recommended a new shot for those littlest ones. The CDC recommendation is that infants who are born during this time frame, shortly before or during that RSV season, who are up to 8 months of age, so newborn up to 8 months, really should get the protective shot against this. Its brand name is Beyfortus. And we're anticipating that those shots will reach providers here in Ohio in the weeks to come. But as you also noted, Governor, RSV can be a serious illness for the elderly, especially those who might be frail due to other health conditions. And there are now 2 vaccines that are approved by the FDA for use in the older population, 60 and older. Now, at this stage, the CDC for that vaccine has recommended that patients have a conversation with their provider to make a decision about whether the RSV vaccine for them is the right choice. So if you're over 60, ask your provider about whether you should get an RSV vaccine.
Okay, so if you're over 60, get the flu vaccine,
Yep.
get the COVID, and talk to your doctor about the RSV.
The RSV option. Yep. And
as an option.
That's
And
right.
for a child, if you have a child from birth up until 8 months, you certainly should be talking to your doctor about the RSV for that baby.
Perfect summary.
You and I looked this morning at the data as far as deaths that are occurring, and we still have an average of 2 deaths a day from COVID in the state of Ohio. And when we look at that, and also when we look at the hospitalization, it's exactly what we would expect. It skews very, very heavily towards those older, certainly over 60, and you get older than that, then the percentages go up as well. And I guess that's just would be one more, we hope, persuasive argument for those over the age of 60 to get the new COVID shot.
I think that's absolutely correct, Governor. When we look at the facts on the ground, when we look at the data regarding who's sick enough to end up in the hospital and who sadly is still dying from COVID-19, that burden rests very heavily upon our population that is 65 and older. And as the older people get, the greater that risk. We know very well from all the data with the vaccines that there is a very significant protective effect from getting a vaccine. And that population is clearly one that will benefit from the new COVID-19 vaccine.
Doctor, I want to go back a moment to availability, and you mentioned a program, Bridge program. You want to explain who that's designed for and what that is?
Yes. So as the distribution and availability of vaccine moved into the more usual commercial distribution that occurs for all other vaccines, the federal government wanted to be very careful, very sure to not have people falling through the cracks. Now, as I mentioned, this COVID-19 vaccine, the new vaccine, should be covered by every insurance program. That's inclusive of Medicare and Medicaid. But there are still, of course, some Ohioans who do not have the benefit of health insurance, but they can also still get the vaccine for free. And that's what this Bridge program is all about. And again, if they're wondering, well, where can I go to get that? It's actually one of the searchable functions on the vaccine.gov website. So if that is your situation, go right to that website and search for sites in your area that are offering the vaccine through the Bridge program.
Doctor, let's take another different category. I am in my 10th day after having been tested positive for COVID. Tested this morning, as it was negative. And for those people who have recently had COVID, what impact then does that have on them getting the new COVID shot?
Sure. Well, one of the things to recognize is that when we get sick with COVID, it has a booster-like effect on elevating our antibodies for a window of time. And we're fairly confident that time frame is at least 90 days. It would not be wrong to go out and get a shot once you're no longer in that 5-day post-infection isolation period, the time you really should stay away from other people. But because we know you're getting an antibody boost from the infection, it would be recommended that you hold off till about that 90-day window and then go and get your new COVID-19 shot then. And again, the real reason for that is to give yourself the maximum benefit of that shot.
So actually, my intention was to get the shot this week, and Fran and I actually are getting our annual physical on Monday, so I won't get the shot. I'll get the flu shot. Fran will get the flu shot as well as the COVID. So we appreciate you trying to clarify this for us, and why don't we open it up for questions?
Okay, our first question today comes from Laura Hancock of the Cleveland Plain Dealer.
Hey, Laura.
Hi, I'm sorry. I was just wondering, I read online that there are some nursing homes, and this was like a national story, so I don't know if this is going on in Ohio, but at some nursing homes, there were issues, just like the new COVID vaccine hasn't been brought to the nursing homes. And obviously these aren't people who can just like necessarily you get out of bed and like go to their local pharmacy. Is Ohio doing anything to get the shot to these people?
We're certainly, and we established a system, as you know, during the heart of COVID, to make sure that these were going into the nursing homes, the vaccine. Doctor, you want to bring us up to date on that as far as the nursing homes in Ohio today?
Yes, absolutely. Well, the state of Ohio and every other state in the nation is really no longer a distributor of vaccines widely. That is all, of course, being handled through the usual commercial channels. What we are doing, though, is working very, very closely with providers of all types, including nursing homes and facilities, to monitor the situation and work with them as we identify challenges to help assure that they are able to get their orders in and that orders flow over the coming days and weeks in a timely manner. But the important thing to recognize is that this is now a part of the commercial ordering, much like they would do for the other vaccines they provide in their facilities. But rest assured, we're watching it closely and we are providing active support.
Our next question comes from Scott Hallis, Xenia Daily Gazette.
Hey, Scott.
Nope, there, I had to unmute myself. How you doing, Governor?
Good.
Good. So this might be better for Dr. Vanderhoff to answer. We've got the vaccines and the shots. I was up to date with the shots. I've gotten COVID 4 times, most recently, I think a week before the governor tested positive. There's a lot of people out there who are saying, well, I'm just not going to get the vaccine because I'll get COVID. I'll get over it really quickly. It's just like the flu. What can you say to people who don't think it's important at this point and aren't going to want the vaccine, even though we know that it could help keep you from getting seriously ill? And is it I mean, is it still okay to call it a vaccine as opposed to maybe a shot, like you get the flu shot every year and you could still get it? It just won't be as bad. I mean, how do you convince folks that it's still real and the vaccine is important?
Well, thanks for that question. And I would say all the communication efforts that we have underway, including this press conference that the governor is leading, are part of our effort to make people aware of the importance of this. I'd say that if you're thinking about getting an updated COVID vaccine, I encourage you to do so. If you have questions about whether the vaccine is the right decision for your personal medical situation, of course, talk to your provider because they know your particular medical situation the best. But our message, I think, is pretty clear. There is benefit for anyone 6 months of age or older who would go out and get this vaccine. But if you are in the high risk group of those 65 and older, those with those underlying chronic health conditions, or something that is having an impact on your immune system, whether it's a medical condition or the medication you take for a medical condition, this is vital. This is especially important because as we look at who's landing in the hospital, that's the population that's landing there. We look at who's dying, that's who most of the deaths are occurring among.
Our next question comes from Christian Hauser, WKRC TV.
Thank you very much for taking the time to speak to me. This is kind of a two-part question. Are there models that are already being looked at to kind of predict what this COVID season could look like, similar to what they do with the flu? And then secondly, if the situation does worsen as we get into those colder months, are plans being developed that would kind of look at trying to get people to go out and get the shot, like those two previous questions have mentioned? It does seem that there is a lot of reluctance from your 60 and under crowd to get this, thinking that, well, I'm healthy enough, I don't have to worry about it. Thank you.
Yeah, let me start and then I'll refer to Dr. Vanderhoff. Look, I think our obligation is to try to give people the facts. Ultimately, the decision whether they get the vaccine or don't is up to them. But we do know that we're still losing 2 people a day who die from COVID. We also know that you're much more vulnerable if you do not have the vaccine. So the data is just abundantly clear, particularly if you're over the age of 60, particularly if you have underlying health problems. Getting the vaccine is, certainly the best thing you can do and give you the best chance of not getting really sick once you get it. It certainly is high, as we've seen around Ohio the last couple of weeks, is highly contagious. A lot of people I know have it, but the vaccine is a protector from you. More likely keeping you out of the hospital and more likely keeping you from dying as a result of that. Doctor?
Yes, and what I'd add to that is the Department of Health continues to monitor COVID activity and all the array of measures that we have shared with you over the course of the past 2 to 3 years very actively. We are not flagging at all in our careful monitoring of the trajectory of illness and what people need to be aware of. And by the way, that's all continues to be available on our website. One of the other things that we have continued to maintain is our robust ability to work closely with healthcare providers, especially our hospitals across the state through our zone network. We didn't mothball that. That's something that we continue to work through, and we continue to work with those leaders on an active basis because we want to remain prepared and able to act quickly if there's any need to do so to support the health of the people of Ohio.
Our next question comes from Danny Eldridge, Hannah News Service.
Hello, Governor and Doctor. Thanks for taking our questions. So it's looking more and more like a federal government shutdown is going to happen. Can you talk about how the state is preparing for that? And specifically for ODH, WIC, I believe, is administered by ODH. Will the state have enough money to make sure women and infants and children continue to get the food they need?
Yes, we've looked at that. We do not see a problem. We don't see an immediate problem as far as delivering those federal services here in the state of Ohio. We do have the money to do that. Obviously, we hope the federal government will resolve this problem and move forward.
Our next question comes from Haley B. Miller from the Dispatch and Inquirer.
Hi, Governor. A few weeks ago, you said that you don't see a need in Ohio at this point for mask requirements. Is that still the case? And if so, are there situations where you and Dr. Vanderhoff would at least recommend Ohioans maybe consider masking again?
Well, I don't see that we're going to be imposing any kind of mask mandates. We're certainly at a different time today. Vaccine is readily available. So I don't see that. As far as protocols, I'll refer that to Dr. Vanderhoff. Doctor, you want to take kind of what the recommendations are?
Sure. In simple terms, our best recommendation is that if you test positive for COVID-19, you should separate yourself from others, isolate for about 5 days. And that during that time, if you really absolutely have to be around other people, it's just things you must do, that's the time that we'd really recommend you wear a high quality mask like an N95. The rationale there really is very straightforward. I think we all want to do everything we can to limit the likelihood that if we're sick, we'll spread that to somebody else.
Hey, our next question comes from Eric Halperin, WCMH TV.
Dr. Vanderhoff, thanks for the time today. Governor, is there anything based on your recent experience with COVID that you'd like to share as you encourage others to get this most recent vaccine?
Well, my experience was fairly light, candidly. This was the second time I had it. I had been vaccinated, as you know, several times before. And I took the drugs that were prescribed as soon as I was diagnosed with it, and frankly, have had a pretty easy time. So I'm in my 10th day, and I feel good.
Okay, our final question today comes from Krista Cano, Gongwer News Service.
Hi, Governor. Hi, Dr. Vanderhoff. Going off of Danny's question, Dr. Vanderhoff, I believe you said that the vaccine distribution is moving away from the federal model into a commercial model, but is there any aspect of a federal shutdown that could affect Ohio's ability to get vaccines and get them to the people who want them? Thank you.
Well, my answer to that would really mirror that the governor gave earlier. It should not. Both the programs I mentioned where ODH receives vaccines from the CDC appear right now to be unaffected. The Vaccine for Children program is, in fact, supported through mandatory funding, according to the CDC. And for the Bridge Access program, the funding and doses have already been allocated.
Dr. Vanderhoff, thank you very much. Thanks, everybody, for joining us.